Hey everybody, welcome to the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. One of the few times that I am in the United States and Emina is away, but she found time to join us. Emina, how's it going?
Hello, everybody. We're recording this, at least I am, from Rome, Italy, where I intend to be for the remainder of the summer, returning possibly to the US in September. We'll see. There's too much happening here, and as I speak to many of you every day, I mentioned that a lot of work can be done remotely these days. So we'll see. We will see. But let's go to what's happening in the US of A. We're recording this on the 4th of July. There you go. We are not turning over some hot dogs. We are turning over the pages of the big bad bill. Oh, I'm sorry, the big beautiful bill, not big bad bill. And we want to deliver to you substantive content about the implications of this on your home care employees, because they will definitely be feeling this. They live in poverty. All right. So a lot of people are looking forward to whatever tax cuts there may be achieved, cutting the loopholes, whatever they may be, in people abusing and overusing social welfare systems. But you cannot forget that those situations are typically the exception and not the rule. A lot of good, deserving people will lose benefits that they have grown up on and gotten accustomed to. And you may say philosophically, well, I don't care about that because I'm a taxpayer and they need to pay their share. And maybe they just have to work a little bit harder to make up for any lost income or the bottom line. We will all be okay. Maybe, I guess that's possible, right? But there's a reason that these programs have been in place. So we'll talk about the impact of this on your employees because those issues will become your issues, right? If they are unable to work for you because they have to commit to a second job elsewhere, that will affect you. And it's already difficult enough to find employees. We know your home care aides are per diem, so maybe they have to find another job to be their main source of income, and you would be just a secondary employer. So there you go. You've got staffing issues again. We'll talk about also how this affects New York State's overall funding for its home care program, because that is primarily Medicaid based. And we've talked about before how New York has some of the richest Medicaid programs in the country. And that is why a number of you who listen to this are able to achieve volume and grow your businesses much faster than entrepreneurs in other industries, right? We don't often talk about how many businesses actually fail in the first few years. And many home care agencies, many, they not only succeed, but they become millionaires. The owners, the founders become millionaires very quickly because the margins have always been favorable and there was simply volume and easily scalable volume. So that may change, right? We already know that New York State is looking to reduce how much it spends on home care. Home care is seen as a system of fraud. But now, with the pressure of federal funding being removed, the state may look for other ways to cut your reimbursement. And we've seen some of that already with these plans. We've seen the plans cutting because they are largely monopolies. There's only a few plans around. And we've seen plans already cutting things because they're anticipating these federal reductions. So with that very gloomy overview, I'm going to turn it over to Sasha to give us more specific details about the big bad, I mean, beautiful bill.
Yeah, we're going to continue a bit of the overview. I'll bring in some specifics, and then we'll further get into more detailed specifics later on in the podcast, right? So we know the whole conversation around cutting Medicaid. Medicare as well, right? If you don't think Medicare is it is being cut. President promised not to. Well, the rate reductions to the patient-driven grouping model that payment model will decrease Medicare home health expenditure by 6.4% or 1.135 billion nationally, right? So Medicare is not being touched. Home care at the child level, these MAP, dual eligibility, all impacted. Now, New York State, as Emina was stating, has been proactive in taking measures to mitigate these cuts to Medicaid. Now, we'll shift to more Medicaid. Let's kind of paint the scenario here, right? Or the cascading impacts. New York State instituted a cap to the nursing home transition and diversion waiver program. So it's going to be 9,400 enrollees at one time, and it's estimated that we currently have about 8,000 enrollees in the program. So you will not be able to get on the program unless someone comes off due to loss of eligibility, institutionalization into a nursing home or a higher level of care, or a person is deceased. All right, now let's just put a pin in that, right? Other impacts to Medicaid cuts, right? Funding to rural hospitals will be decreased. Sure, there are carve outs, which I'll go over in a second, but which the carve outs are essentially a block grant. But hospitals are constantly being bailed out by the government, state and federal. So if you think that this is not going to, these carve outs aren't going to affect, I think the fears of hospital closures or rural hospital closures is still real, right? And it's going to impact more than just the rural hospitals. Carve out provides $50 billion in grants to the states between fiscal year 2026 and 2030, but that's to be shared among the states, right? So let's assume a $1 billion per state, right? 40% of the payments will be distributed by CMS based on certain population and income requirements, and and also those meeting certain care requirements. Now, funding for nursing homes will also be decreased and could lead to closures of nursing homes. And if you have fewer nursing homes in the hospitals, will not be able to discharge patients to the nursing homes for recovery, and therefore they won't be able to flip the beds. It's kind of that language we don't necessarily want to think about that, but like I was flipping a table at a restaurant. But yeah, the hospitals need to flip the beds to be able to serve patients, make money, and stay open. Right. So if they can't discharge to the nursing homes, then that is going to limit care, increase wait times, and if this is based on the current rules of the hospitals required to provide service, that will likely be impacted by the requirements of limiting care to immigrants. Right. We'll come back to that later. So the nursing homes can't discharge patients to the NHCD program, right? We put a pin in that, so we're taking the pin out and moving it here. You can't go to the NHCD program getting care in your home. Therefore, beds at the nursing homes are taken, and this is the snowball effect, right? Now, let's say that you can provide some services in traditional home care, right? The Medicare, so MAP eligibility and funding that the plans were looking to because of high reimbursement, that's going to be impacted. Traditional home care, CDPAP, all of it will not be able to take up the slack. And then now let's shift to the workforce. Workforce are going to be impacted in professional lives and at home. All the while, Canada is rolling out the red carpet, inviting everybody to come to Canada because worldwide there are shortages of providers at all levels, home health aides to nurses to doctors worldwide. Canada is going to give you reciprocity within 1 week, and you're going to be able to get your residency papers all within 1 week. It's a little colder, sure, but you can get a coat. And like, let's speak specifically to the Haitian population, which currently right now being targeted. Haitians are fighting back physically defending themselves, and the way the conversations are going, more populations are going to take uh, that approach, and they're going to fight back physically. Okay.
What was in the streets? Sorry to cut you off, but I
Yeah.
want to just jump in here. I saw like all these news reports about
Yeah.
Haitians protesting, ICE going in there. They're like attacking their cars. I hope nobody got hurt.
No, they were kicking ICE's butt, physically handling ICE, right? So I mean, this is a culture that is revolutionary. Like the part of the destabilization in Haiti is that Haitians revolt on a drop of a dime. There's
Yeah.
manipulation that occurs by the billionaire class, and every election they pay the gangsters to go do stuff. Right. Well, this is not that political podcast, but I'm Haitian background and I just know this stuff, and that's going to happen. We are a revolutionary people. But let's say we don't go down that path, and there is a huge Haitian population in Canada already. So therefore, the transition, and Haitians speak French, they might just go to Canada. Haitians aren't just home health aides. All immigrant populations are engineer, doctor, nurse, um, and lawyer. That transition with a welcome mat, then people might just say, "The heck with it, I'm out." European immigrants are being targeted as well, though it's not as spoken about or as reported. Uh, China's China's recruiting everyone. And if you are educated and you're intellectually curious, you see what's happening. China's universities have populated the top 10 research hospitals in the world. You see what they're doing with their train systems. Their cars are kicking our butts. Their military seems amazing. Taiwan is where chip manufacturing is done. The US still has the intellectual property rights on that, but it's there. If I just kick the US out, I just take the blueprint and I just make them. If I'm not respecting your intellectual property. And they have the minerals. We are not doing ourselves any favors, right? And I don't know if I mentioned this before, but the staff who the pressure they're going to feel is that the Medicaid eligibility requirements, or not just Medicaid, but any assistance, housing and food assistance. If you're making $20,000 a year, now you're not gonna be eligible, right? Like there are families. I think a family of four. I think it was in the 32,000. A single person 15,000. So that single person making 20 now is not going to be eligible. So you're going to have all these pressures trying to retain people in the U.S. while the immigrants are fighting to try to stay here. Americans are trying to leave. Right? I mean, part of my decision to move to Costa Rica during the pandemic was, hey, it's the pandemic. Doesn't matter where you get educated. We can remote. And then after the pandemic, we're like, all right, get kids learn to speak Spanish. My wife's from there, and we can do stuff, started a business there. But Americans are leaving. Like that was part of it. I was like, hey, this is during the Trump era. I don't know if I need a bug out bag, and I need a backup plan to just lay low while not
Like,
everybody has that opportunity. You know who has it? Immigrants have that opportunity. Americans don't.
what, to leave?
Yes, yes.
No, so I'm on all of these forums where American-born people are saying, I don't like this, I'm leaving.
Yep.
And then there's two groups of those people, people who are able to work remotely and others who are very resourceful and they will make a living somehow. They'll figure it out. But they look for a country that has reasonable cost of living. They migrate over there. And it is welcoming, the residency requirements, et cetera, are not as arduous on newcomers. So there's those people. Then there's people that you're referring to who are immigrants, like myself. I wasn't born in the US, but I have the means of going back anywhere in Europe pretty much because I have a base and a nationality in another country as well. That's not just American. and the cost of living is significantly lower. Is it democratic? Technically, no. Is there some political unrest and corruption? Yes. But you know what I've realized over the last several months with watching Trump in the office? All these other countries that we say are not democratic and are corrupt, I mean, that is just a narrative, right? We have a lot of our own corruption, except it's just known, largely known. Every once in a while, there's an expose to reveal some unknown corruption, but usually it's just out there in plain sight happening. Whereas in some of these other countries, it happens behind closed doors, or like in Italy, where people know who you can buy off and who you can't, and somehow it's like to be
But it's
expected.
legal now. It's legal now for U.S. citizens to bribe foreigners under the
Yeah,
administration. It was legalized this year.
yes, it was made legal. It was made legal to accept gifts from countries that are supposedly a threat. It
Yeah,
was,
the whole banking system is, look, banking goes back a while, but some of the things that the products that they have is from what the mafia used to do. Right? Bill Burr has a joke about that, right? Like it's legal when the banks do it, but the banks won't break your legs. The mafia, they just break your legs. These high interest rates and this predatory, the same day loan, whatever short-term loan programs, charging you 20, 30, 40%. That will just ruin your credit, ruin your life. We won't kill you, but yeah, no, it's bad. We just legalized the corruption. And that's why it's not considered corruption. Let's go Medicaid eligibility, right? Which is tightening, right? The Office of Health Insurance Programs released the memo with the subject implementation of minimum needs requirements for personal care and consumer-directed personal assistance services and managed long-term care enrollment. So effective September 1, 2025, any individual seeking PCS, CDPAP, and or MLTC enrollment through the assessment process must also be assessed to meet the following minimum criteria to be eligible for those services. They must need assistance with physical maneuvering with more than two daily activities of daily living, right? So now you need three. It has been two for a while. Now this was passed in 2020 and delayed due to COVID and general cutting requirements, but also triggered by this. New York State has implemented it, right? So now you need three activities of daily living that you need assistance with, which is going to knock a certain percentage of people off eligibility. There are many people who already have the three or more, but those who do have two, they may have three, but they're going to get knocked out for a bit and need to do a reassessment to add that third. But that is a maneuver or a tactic to reduce. Individuals with a diagnosis of dementia or Alzheimer's need at least supervision with more than one ADL. Existing recipients will be grandfathered in, though I'm not certain if these rules apply to recredentialing, which needs to happen on a semi-annual basis, right? Are you grandfathered in moving forward indefinitely, or at reassessment, do you need to meet these requirements? That I'm unclear of, and as we get some clarity on that, we'll bring that back to you. Under the current law, states are required to provide Medicaid coverage and and pay for qualified medical expenses incurred up to 90 days prior to the date of application of coverage. But the new law will reduce that to 30 days, effective December 31, 2026. And there's reduction of the total home equity value will be reduced to $1 million. That's down from a high of $1,097,000. And this is regardless of inflation. So 1 million is the number. And the new law allows states to differentiate standard homes to farms, right? And this is going to be effective 2028. A lot of these things are delayed impacts, but the NHTD things of that nature are effective immediately. And this is the state trying to get ahead of it and trying to reduce its expenses for when some of these cuts actually hit. Now, the next thing I want to go into is the financing, how some of this will be funding or some of the uh, cost reductions, right? So states are prohibited from establishing any new provider taxes or from increasing the rates of existing taxes, right? So the MLTC tax applies here. This new limit applies to taxes on all providers except nursing home facilities and intermediate care facilities, further putting pressure on the nursing home industry. Disproportionate share hospital payments, which provided payments to hospitals that serve disproportionate the percentage of low income, uninsured, and Medicaid recipients will see a $9 billion per year reduction effective September 30th, 2028. Right? Further impacting the hospitals. And, this is something where states will likely, or hospitals will likely need to change their policy on not servicing undocumented persons, right? This progressive move where in Europe you just walk into a hospital and get care. Just it's all about caring for individuals. In the U.S., you don't have an insurance card, you don't have any money in your pocket, and get out. This is absolutely insane, right? I mean, step back a sec. Do I understand that the undocumented population and those expenditures do impact the level of service and care that we could get as citizens? Yes. Do people come over the border and just have babies and get care and because it's better here and what have you? Yes. I guess I would say that we need to, as citizens, have this conversation about what we want, what kind of people we want to be. But I guess this is the conversation, and our representatives have decided, no, we're not going to provide care, right? And I'll tackle Obamacare because Obama cares, right? Later, but this is the conversation. We don't want to provide that level of care, right? So this is actually speaking of Obamacare. A lot of this is targeting states that expanded Medicaid as part of the ACA, where HHS is to revise the state-directed payment regulations to cap the total payment rate for inpatient hospital nursing home services at 100% of the total published Medicare rate, right? So that rate is what it is. They're not going above 100%. Um, and yeah, so that's that they're looking to get some savings from that. And there's an additional requirement to the 1115 waiver program to be cost neutral, right? The 1115 waiver program provides multi-year continuous eligibility for kids, re-entry services, people who were incarcerated, coverage for health-related social needs such as housing and nutrition programs. This will likely result in increased recidivism and feed the prison industrial complex, right? Thereby increasing the slave labor that is enshrined in the 13th Amendment. Uh, we're in trying to keep this conversation focused on home care and health care. It is very difficult to do so, understanding how other factors come into the decision making here, many of the isms, but trying to just speak healthcare without considering that is very difficult. We'll try to figure out a way to do so, but if it is necessary for us to touch on those topics, and I can give you, some of the hundreds of books that I've read on the subject, if you need to do your own research. But information's there. One good thing, I guess, is no change to the FMAP funding calculations, where mandated that 50% plus contribution from the federal government to the state for qualified medical services. This new law prohibits the Secretary of Health and Human Services from implementing and administering or enforcing nursing home staffing rule requirements that were passed under the Biden administration, requiring long-term care facilities to meet minimum staffing levels, including 24/7 RN on site, and a minimum of 3.48 total nursing staff per resident per day. Now let's talk about the Affordable Care Act. Right? This is part of the things that will affect your staff. Do we need to acknowledge the, Tillis from North Carolina, Paul from Kentucky, and Susan Collins who said no on this? Great. You have
It's
moral.
a token no. They knew it was going to pass. It's
Right.
a token no. I read an article a few days ago where it's like, yeah, we have these outlier Republican senators that every once in a while will vote outside of their party, but is it really genuine? Nah. They take straws, they pull straws to decide which one will be on the Democratic side, whatever.
Right.
So, yeah,
Yeah.
it
It's
passed.
it's political to keep the House in control, and they allow them to say no on certain things to keep the vote. Yeah. So I mean, we talked about the cost sharing, the changes in cost sharing requirements under the ACA requires states to impose cost sharing on Medicaid expansion enrollees up to $35 per service on expansion adults, right? Those who took advantage of the ACA expansion with incomes of 100 to 138% of the poverty level, right? Again, individuals, $15,650 per individual, 32,150 for households of four. It does exempt some primary care services, mental health, and substance abuse disorders, but you start limiting payments or support for parts of the system, ends up collapsing the whole system because one service may support another service that is losing money. And they're investing in the implementation of this law, and these cuts to the ACA by $15 million for the implementation for fiscal year 2026. Now, effective date is October 1, 2027, to reduce the expansion match rate from 90% to 80% for states that provide healthcare coverage or financial assistance, including using their own funds to purchase healthcare for individuals who do not have qualified status and who are not lawfully residing, children or pregnant adults covered under the Medicaid option for these groups. Again, because you expanded Medicaid, you will be penalized. Minimum 10% reduction in funding. So it's either you're going to reverse that, or you're going to stick with the 10% reduction. What does that look like to your citizens? You're we're in a place of self-preservation. Self-preservation makes you say, "Hey, sorry, immigrants, we're dying here. We need to think about ourselves," right? Rugged individualism. That's America. It is what it is. Just understand that if we were in that movie where we had to make a choice of, do we blow up the other ship? I don't know if Americans would make that decision to trust in uh, our citizens. Not at this point, maybe before. So in effective October 1, 2026, there's going to be limits in the federal matching for emergency Medicaid for individuals who would otherwise be eligible under expansion uh, coverage, except for their immigration status, right? Again, cutting of funding for states who decide to take care of immigrants. Lastly, these are miscellaneous items, part of this bill. It's going to allow out-of-state providers who provide pediatric services up to a 5-year period where they can operate in, across state lines. It is specific to pediatric. I don't know if that will expand. Um, let's count that as possible good. Uh, maybe good for blue states. I don't know. Red states generally are in trouble. But people don't vote for their best interest. Medicaid provider screening requirements states to conduct these checks at enrollment, re-enrollment on a monthly basis to determine whether HHS has terminated a provider or supplier from Medicare and or another state has terminated a provider or supplier for participating in Medicaid or CHIP, and to verify that the provider is not deceased and their credentials are being used fraudulently. I don't necessarily have a problem with that. Let's keep doing that in addition to the SAM Omega OMIG checks. And that could be a cost neutral or cost savings if we discover fraudulent activity. So that sounds fine. Last thing I have here is not necessarily a bad thing, where under the prescription drug pricing and rules for pharmacy benefit managers, it establishes requirements for PBM payments to pharmacies and prohibits spread pricing. Spread pricing refers to the difference between the payment the pharmacy benefits manager receives from the MCO and the reimbursement amount it pays to the pharmacy dispensing to the beneficiary. So if we can manage costs in that way, not a bad thing. But a few good things, a lot of difficult laws and regulations passed here. And listen, you got to put on your thinking cap and figure out how you're going to navigate this thing. Emina.
Thanks so much, Sasha, for the big bad slash beautiful bill recap. And thanks everybody for tuning in. We promise to continue bringing you news and updates and our commentary over the summer, perhaps at a slower pace because I am in the land of Dolce Vita. But we're still here for you. Thanks so much. Hope you're enjoying your summer.
This has been the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. Have a good one.